Good science is perhaps the only thing that can help India defeat this pandemic. But 18 months into this crisis, India still cannot agree to the right prescription, the right course of treatment for patients. Now, if you have fought and defeated the Wuhan virus in India, you would have heard of these names: hydroxychloroquine or HCQ, Ivermectin, Doxy, Favipiravir, azithromycin, and supplements like zinc and multivitamins. If you've been treated for the Wuhan virus in this country, it's very likely that you've taken most of these drugs. Now, here's a bitter pill for you to swallow. They were all useless. None of these drugs work on the Wuhan virus. And we are not saying this. India's health ministry is. It has removed all these medicines from India's COVID treatment plan. For months, we've been reporting on how India's prescription is outdated and how research and studies the world over show most of these medicines do not work against the Wuhan virus. But in India, they make up the entire prescription for treatment. During the deadly second wave, we saw a flood of social media appeals for these drugs. We saw people struggling with shortages, paying inflated bills, running from pillar to post to get medicines that are now being declared useless. Imagine the kind of trauma they could have been saved. In recent days, lawmakers have been booked for hoarding the same drugs. Turns out there is no guarantee that they work. They've been dumped from India's treatment advice. First, it was blood plasma, and now unreliable drugs. I hate to say, we told you so. Last month, we reported how some of these drugs make no or little difference when it comes to saving lives. Here's a quick recap. Guidelines have not changed. They have not been updated since the pandemic began. CQ is still part of the treatment protocol. ICMR guidelines advise this tablet for mild patients. ICMR's treatment plan features more such unproven drugs for the treatment of the Wuhan virus. Next on our list is Ivermectin. This is the body that's supposed to guide our response. The second wave has spread from urban centers to rural ones, and the master prescription to treat patients in India suggests outdated and written off cures. That report was about India's treatment protocols. They're published by the Indian Council of Medical Research, or ICMR. Guess what? The ICMR's guidelines still lists some of these outdated drugs. Last we checked, the ICMR had published its latest clinical guidance on the 17th of May. And it still lists HCQ, Ivermectin, and multivitamins for patients who are recovering under home isolation. Even while the Health Ministry of India advises against these drugs, the ICMR continues to back them. So India now has two prescriptions to treat patients, two different sets of advice. The ICMR's advice lists unreliable drugs, while the Health Ministry says mild cases can be managed by treating the symptoms with drugs for cough and fever. This is a recipe for disaster. Such confusion and lack of reliance on science leads to three things. One, patients will continue chasing drugs that don't even work. Two, they will continue consuming unnecessary drugs that may harm them in the long run. And three, they will continue paying a lot of money for futile treatments. And all of this is already happening, by the way. Let me show you some numbers that we've crunched for you. I'll start with the vitamins. In 2020, Indians bought more than 5 billion pills, 5 billion, of vitamin C, zinc, and multivitamins. What about this year? In April 2021, the sales of such vitamins shot up by 75%. Top companies sold more than $30 million worth of vitamins. It's the same story for other drugs. HCQ, hydroxychloroquine, was sold as a miracle drug at the beginning of the pandemic. In 2020, more than 220 million HCQ tablets were sold between the months of March and May. Soon the craze fizzled out, only for other reliable drugs to take its place. Unreliable drugs like Favipiravir. Between June and December last year, sales of Favipiravir were worth more than $58 million. In April 2021, Favipiravir earned the same amount of money in a month. More than $50 million worth of this drug was sold in India. Long story short, India spent millions of dollars on unproven drugs. And if that's not bad enough, unnecessary consumption of some of these drugs may have harmed us. I have some examples again. HCQ, there was a time when everybody was taking it. Then doctors found a link to serious heart rhythm problems, so they stopped prescribing HCQ. Same with multivitamins and zinc. India has reported around 12,000 cases of black fungus in Wuhan virus patients. It's a serious concern. Now, earlier these cases were linked to bad hygiene, but experts now fear that blanket use of zinc in treatment could have had a role to play. The presence of zinc in your body creates an ideal environment for black fungus. Experts say there is a need to investigate this possible link between the indiscriminate use of zinc supplements and black fungus in India. Who will be held accountable for all of this? For the desperate chase for useless medicines, for the millions spent on these medicines, and for the health hazards that they may have led to? India needs an updated and scientifically backed prescription. As we brace for a third wave, we must first fight the pandemic of unreliable drugs. WION is now available in your country. Download the app now and get all the news on the move.